One can just imagine the absolute devastation and rage from families whose loved ones have passed away due to negligence, facilities not adequately working. And we know the situation at Tembisa Hospital is not a new one. It has been like that for a very long time. And that is the situation that so many of our hospitals also find themselves in. You know, should the public be the ones who are going out petitioning to have these hospitals fixed? Or does this really lie solely and squarely on the shoulders of the health department to make sure that their facilities are up and running and that all the adequate equipment that is needed to save lives and for them to do their job, that all of that is actually provided for? Why do communities, elect leadership? Why do we elect government? So that they can do the things that we ourselves cannot do. It's a proxy that they are given, and it's up to them really to fulfill that mandate. We continue today with our coverage focusing on the health workers, the plight that they face, as well as their day-to-day activities and their day-to-day experiences as they deal with the COVID-19 pandemic. They are our frontline workers. Joining us now is Claudia Mangwegape, and she is the Free State Red Cross Manager, who is also a contact tracer. Thank you so much for joining us today, Ms. Mangwegape. Thank you very much.
Thank you so much for pronouncing my surname as well. Thank you to your listeners.
Thank you so much, ma'am. Won't you tell me about the job that you do as a contact tracer day to day? And is this something that you're still doing now with the second wave?
Yes, we're still doing it with the second wave. Actually, our work has actually increased now because we have seen that a lot of cases have actually went high. And as a result, we have actually now deployed more volunteers because we know Red Cross is a volunteer-driven society. That is also international. So we have been providing training and making sure that we equipped our volunteers with the necessary skills to actually assist the government in actually all the provinces. So what we have done is we have upscaled the work that we have done and also providing PPEs with support that we've also been getting. So daily, our activities would be that we would get the people that has tested positive for COVID, and then we then do the contact line listing. After that, we do the tracing, whereby we would then identify those people and make sure that they go and get tested. This has been a collective work between Red Cross and the Department of Health because there is an agreement that has been signed at the national level. So that's why you would see that in other provinces, actually in all the 9 provinces, Red Cross is working closely with the Department of Health.
Now, Claudia, Claudia, so often, you work with people, and especially in your case, you work with total strangers and have to contact trace total strangers. But this is also quite personal to you. You've had your own experience. Tell us about this.
I think the first week of Jan, one of my cousins tested positive for COVID. And I then had to engage with the department, the professionalness, and then I went to do contact tracing. We went and then we tested all of them, including all of my cousins, my nieces as well, including my uncle and my aunt. And as a result, 8 of them tested positive. And then my uncle passed on the 13th of this month. And then my aunt later on the 15th. So I lost 2 of them, and it left quite an emotional scar for me because I was there. And the last time I saw my uncle and my aunt was when we tested them for COVID. So after that, they were admitted in the hospital because we then did what we call it's linked to care. So it was quite an emotional journey, but it's part of my work, and I've been trying to deal with it because at work they also provide psychosocial support for our volunteers, including staff as well. So I've been going through the support and to check that I'm emotionally fit to continue doing contact tracing to our communities as well.
For those, Claudia, who have not had the privilege of having that psychosocial support that you talk about, ordinarily, what goes through the process of being counseled when you've lost a loved one in an instance like this?
Usually we have our trained volunteers. Others are actually professionals, like our social workers. We also have a clinical psychologist. They would have one-on-one, and the Department of Health also have their own support structure in terms of psychosocial support. So they do counsel their patients. There's also trauma counseling for those who have lost their loved ones. Even with care of the caregiver, working with volunteers, they then end up, being stressed and bending out because of the situation that we're having is too much to handle at the same time. And, not only focusing on contact tracing again, because our volunteers also do RCCE, which is risk communication and community engagement, where we try to educate our communities, because there's a lot of misinformation that is going around on our social medias. So we try so that people could actually understand the work that we do, and also just to understand the seriousness of this COVID-19, because we've also, as frontliners, lost our loved ones. We have lost colleagues as well. We've buried close to 3 so far this year. I mean, it's something that is not nice as well. So COVID is alive, and we need to keep on adhering to the regulations of COVID-19. Social distancing, continuously using your mask and making sure that you wash your hands regularly, even sanitizing.
I'm quite interested, Claudia, to find out the tools that you use in order to do the contact tracing. Is a lot of it electronic, phone calls, or do you actually personally go to some of these homes and to some of these people?
There is a call center that is actually run by Department of Health with some of our volunteers. And also the other one, it's physical, whereby the instances where we cannot reach some of the communities, then we'll then go in with our full PPEs, protective clothing. So our head office do supply us with protective clothing. So when we go in, would have your professional nurse that will then collect swabs, and then we'll also engage with some of the communities to find out who were they close, who they were in contact with, so that we try to keep, because remember, the virus does not move. People as us, we are the ones that are spreading the virus. So we try to engage them, to isolate, and and refer them if they cannot isolate or quarantine at home, because some of people that we have actually traced are people that are staying in small places, and then we'll then refer them to the department, whereby they'll be given to the they will be actually be referred to the quarantine site. So those are some of the things that we were able to do, and it has worked nicely. Whereby
I wonder,
from
Claudia,
us,
from a personal perspective, the fact that you also have lost loved ones, did that in any way change the manner in which you do your work? Did it somehow affect the way that you do your contact tracing after having had that personal experience yourself?
Yes, it has, and I believe it goes with trying to think about the motto of the society when it says always needed, always there. I'm trying to do as much as I can, because after I've lost my family, I felt that maybe I could have done enough. Perhaps I didn't do more than what I was supposed to have done. And I'm trying to work as hard as I actually did before. So that has actually put me in a position whereby we're trying to use all the resources that we have to actually assist our communities, because I don't want to lose any other community member in my any other family, even some of our community and friends. I don't want to lose any of the people that I know that are close to me. So I'm doing a lot. And as of today, we received a lot of protective clothing from our HQ. and will continue to enforce and support the Department of Health where we can.
Claudia, thank you so much for your time, and our condolences as well for the loss that you and your family have suffered during this time. Thank you for speaking with us. That's Claudia Mangwegape there. She's the Free State Red Cross manager, and she's also a contact tracer. I love that phrase that she used there. She says, the virus does not move, the virus does not spread. It is us who move, and it is us then who in turn spread the virus.